Hello, future nurses. All right, if you're an LVN student staring down your cardiovascular exam, just take a deep breath. We are about to cut right through all the noise and focus on the absolute must-know concepts that are going to make a huge difference for you on test day. So here's our game plan. We're going to build your knowledge from the ground up, starting with the heart's basic blueprint. Then we'll get into decoding the signals the heart sends when things go wrong. After that, we'll look at what happens when the rhythm fails. And then we'll put it all together with the key nursing actions you absolutely have to know. Sound good? Let's dive in. All right, first up, the heart's essential blueprint. You know, the easiest way to think about the heart is to picture it like a house. It's got plumbing, which moves the blood, and it's got wiring, which powers the whole thing. If you can get these two systems down, you've pretty much got the foundation for everything else. Okay, let's talk about the plumbing. Imagine we're following a single drop of blood. It comes into the right atrium, all tired and out of oxygen. Then it goes through the tricuspid valve into the right ventricle. The right ventricle gives it a big push through the pulmonary valve and sends it off to the lungs for a fresh tank of oxygen. Now it's back, full of oxygen, and enters the left atrium. It passes through the mitral valve into the powerhouse, the left ventricle, which gives it one last mighty squeeze out through the aortic valve to the rest of the body. You have to know this one-way path. For your exam, lock this flow in. So what about the wiring? Well, it all starts with the SA node. Think of it as the heart's natural pacemaker. It fires, and that electrical signal travels to the AV node. Now, here's the really cool part. The signal actually pauses there for a split second. And you might be wondering, why? Well, that little delay is absolutely genius. It gives the ventricles just enough time to fill up completely with blood before they get the signal to squeeze. That pause is what makes the pump so powerful and efficient. All right, on to section 2. Decoding the heart's signals. So what happens when that plumbing or wiring goes a little haywire? Well, the body starts sending out distress signals. And as the nurse, you're the detective. It's your job to read the clues. Let's start with the labs. This is the hard data that tells you what's really going on. This table right here, this is exam gold. So listen up. If a test question mentions crushing chest pain, your brain needs to immediately jump to troponin. It is the absolute gold standard for seeing if the heart muscle is damaged. Now, if the question talks about a patient who's swollen and short of breath, you should be thinking BNP. If that number is over 100, it's pointing straight to heart failure. It's really that simple. Next up, the ECG. So this is basically a printout of the heart's electrical activity, that wiring we were just talking about. Let's break it down. You see that first little bump, the P wave? That's the atria contracting. Then you have that big spike in the middle, the QRS complex. That's the big, powerful squeeze from the ventricles. And that last little wave, the T wave, that's just the ventricles relaxing and resetting for the next beat. So just think, atrial squeeze, ventricular squeeze, and reset. So now that we know what a normal rhythm looks like on an ECG, let's talk about what happens when that rhythm fails. In this section, we're going to hit the most common dysrhythmias, the ones you're definitely going to see on your exam and out on the floor. Let's start with the two ends of the speed spectrum, sinus tachycardia and sinus bradycardia. Now, in both of these, the rhythm itself is actually perfect. The SA node is doing its job, leading the charge. The only problem is the speed. Tachycardia is the heart running a sprint. We're talking over 100 beats per minute. You see this with things like fever or anxiety. Bradycardia, on the other hand, is the heart taking a slow jog, under 60 beats per minute. Now, this can be totally normal for an athlete, but for someone else, it could be a red flag. Okay, now for a really chaotic rhythm, atrial fibrillation, or AFib. With AFib, the atria aren't squeezing anymore, they're just quivering. This is what causes that classic, irregularly or regular rhythm you'll hear about. But here's the real danger. It's not just about an inefficient pump. When blood just sits around and doesn't move, it starts to clot. Those quivering atria become a perfect breeding ground for tiny blood clots that can shoot straight up to the brain and cause a massive stroke. And that's why, for any AFib patient, the number one priority is anticoagulation. Okay, section 4 is ischemia. And let me tell you, this is a topic you are absolutely guaranteed to see on your exam. You have to know the difference between chest pain from a temporary lack of oxygen versus chest pain from permanent heart muscle death. This slide has everything you need. Let's just boil it right down. Angina is the heart basically screaming for more oxygen. An MI, a heart attack, is the heart muscle dying because it's getting no oxygen. So how do you tell them apart? 3 key things. Number 1, does the pain get better with rest or nitro? If it does, it's angina. If it doesn't, you have to suspect an MI. Number 2,
Look at the troponins. They'll be normal with angina, but elevated in an MI. And number 3, the outcome. Angina is a warning shot, and MI means permanent damage. That's it. That's the core of it.
And finally, let's get to the most important part of all, your role. When a patient looks at you and says, "My chest hurts," all this knowledge has to turn into immediate, life-saving action. This section is all about what you do.
The nitroglycerin protocol is an absolute must-know. Here's how it goes. 1 tablet under the tongue. Then you wait 5 minutes. And before you even think about giving a second dose, you have to check their blood pressure. Why? Because nitro is a powerful vasodilator, and it can make their pressure totally bottom out. If the pain is still there and their BP is stable, you can give a second dose, and then maybe a third, 5 minutes apart. But if 3 doses do nothing for the pain, you're not dealing with angina anymore. You're dealing with a heart attack, and you need to call the provider right away.
You know, your most powerful tool isn't a medication or some high-tech procedure. It's your teaching. The instructions you give your patient about their diet, their meds, and when to call for help, that's what's going to keep them out of the hospital. On your exam, and especially in real life, remember that your teaching can literally be the difference between a patient thriving at home or getting readmitted. So, as you wrap up your studying and get ready for this exam, just remember, everything we talked about today is a tool. It's a tool that's going to let you be that calm, confident, knowledgeable person in the room when a life is on the line. You're not just studying for a test, you're preparing to be that critical link for someone. Now go ace that exam and then go be the amazing nurse you're studying to be.